Have you ever forgotten something crucial like an appointment, a password, or the name of a college friend? You've likely worried about memory loss, and it's understandable. Neurological diseases like dementia, Alzheimer's, Parkinson's, and ALS are rapidly increasing. Over 55 million people live with dementia today, and that number could reach 150 million in 30 years. To illustrate, a new dementia diagnosis occurs every 3 seconds. How can we safeguard our brain health? What if I told you that your sleeping position could make a difference? Today's video explores how the way you sleep can protect your memory and guard against neurological issues. It's simple to implement. But first, like this video, subscribe to our channel and hit the bell icon for notifications on upcoming content. Share it with friends and family because many people face memory issues, and you can help protect loved ones by spreading the word. Have you been forgetting things? Do you sleep well? Where are you from? Comment below. Sleeping on your right side can change your life and might cleanse your brain. Let's dive in. Why the surge in neurological diseases? Factors like an aging population, sedentary lifestyles, poor diets, and chronic stress contribute. Our fast-paced life, with less and worse sleep, along with increased rates of brain-damaging diseases like diabetes and hypertension, play a role. Additionally, environmental toxins like pesticides and neurotoxic agents can cause problems like Parkinson's. There's also concern over heavy metals and air pollution. Despite these challenges, our bodies are resilient. The impact of COVID-19 on the brain is also notable, with memory loss, attention deficits, language issues, and decision-making difficulties reported. Research shows COVID can prematurely age the brain by causing nervous system inflammation, accelerating dementia, and activating dormant genes. So if you forget a password, don't panic. What is dementia? It is a syndrome characterized by the decline of brain functions such as memory, language, attention, and reasoning, which significantly affects daily activities. Alzheimer's is the most common cause, accounting for about 70% of dementia cases. Dementia is a global public health issue that demands urgent attention. It affects not only individuals but also their families, causing great stress and sadness. One of my patients, a once brilliant university professor, is now a shadow of her former self, which is heartbreaking for both her family and me. Current medications are only palliative and cannot stop the disease's progression. In the U.S., 2 new drugs show promise but are expensive and risky. They might help but remain inaccessible for now. If you're concerned about memory loss, it's important to differentiate between normal forgetfulness and dementia. Forgetting keys occasionally is normal, but frequent forgetfulness that disrupts daily life might indicate something more serious. Normal memory loss includes sporadic forgetfulness of names, dates, or events, and difficulty remembering object locations, often improving with hints. This happens mainly due to distraction. When distracted, our brains don't focus on storing new information, leading to forgetfulness. Chronic stress can damage the hippocampus. Lack of attention or association with other stored information weakens memory. If you forget the name of a college friend after 40 years, it's normal as unused memories fade. Conversely, dementia involves persistent and progressive memory loss. Dementia patients struggle with learning new things, but can still learn. It also involves personality, behavior, and mood changes, and difficulty with tasks once simple. For instance, forgetting where you parked is normal, but forgetting how to drive is dementia. Not recognizing familiar people signals dementia. Remember, dementia is not a normal part of aging. If you're concerned about your memory or someone else's, consult a doctor for a thorough evaluation. This video is crucial for recognizing early signs, but seeing a specialist is beneficial. Early dementia diagnosis is vital for treatment and management, and there are many types, each with its own symptoms. Most age-related memory loss doesn't indicate dementia, and there are steps to maintain brain health and reduce dementia risk. How can we lower this risk? I'll ask 8 questions. Grab paper and pen to answer yes or no. First, do you eat healthily with plenty of fruits, vegetables, and whole grains? If not, subscribe to the channel. Second, do you exercise regularly for at least 30 minutes daily? A sedentary lifestyle raises dementia risk. Third, do you get quality sleep, at least 7 hours per night? Both insufficient and excessive sleep increase dementia chances. Fourth, do you keep your mind active with reading, puzzles, or learning new things, even on YouTube? Fifth, do you manage stress through techniques like meditation, yoga, or journaling? Sixth, do you maintain an active social life with friends and family? Social isolation raises the risk of heart attack, stroke, and dementia. Seventh, do you have regular medical checkups and control conditions like diabetes, hypertension, arrhythmia, and cholesterol? These are crucial as they all harm your brain. Eighth, do you avoid smoking and excessive alcohol consumption? Tally your yes answers. The more yeses, the better. A perfect score is 8. If you scored 5 or less, you need lifestyle changes quickly, regardless of age. It's by planting the right seeds now that you'll harvest a healthy brain later. How does your sleeping position affect brain health? First, I need to explain the link between sleep and brain function. Why is sleep vital for the brain? All animals sleep. Experiments show that depriving animals of sleep can be fatal within days or weeks. Sleep benefits the brain itself. Until 2012, we believed the brain cleaned itself, recycling waste like the body's lymphatic system does for excess fluid, preventing swelling, defending against infections, and removing impurities. The brain's lack of a visible lymphatic system was a mistake. It was only discovered with advancements in brain imaging technology and functional magnetic resonance. Researchers found the brain's cleaning system activates during sleep. This system, called the glymphatic system, involves fluid-filled tunnels around blood vessels that, with each heartbeat, clear brain waste. Thus, sleep is essential, not just for rest, but for brain cleaning, reducing the risk of dementia and other neurological diseases. When awake, these tunnels deactivate, but more than 95% of glymphatic flow occurs during sleep. Without this cleaning, neuron communication is affected, and harmful proteins like beta-amyloid and tau accumulate, hallmarks of Alzheimer's, which constitutes 70% of dementias. Studies show people sleeping less than 7 hours nightly have a higher Alzheimer's risk, likely due to insufficient brain cleaning. Aging decreases sleep and arterial pulsation, which drives the glymphatic system, explaining links between hypertension and dementia. How can we maintain a functioning glymphatic system? First, ensure adequate sleep, at least 7 hours per night. Second, control blood pressure. Third, exercise regularly as it improves blood flow and glymphatic function. Studies on mice show physical activity boosts glymphatic clearance, reducing harmful protein buildup. Lastly, sleep in the right position, on your side, preferably the right side. Mice naturally sleep this way, facilitating brain blood drainage. Human research shows right-side sleeping is more efficient because the right jugular vein drains blood from the head better. Neurodegenerative disease patients often sleep on their backs, which might hinder glymphatic drainage, while healthy individuals mostly sleep on their side. Dementia patients spend more time sleeping on their backs compared to healthier individuals, suggesting side sleeping might aid in toxic protein elimination from neurons. If you sleep on your stomach or back, train yourself to sleep on your side using techniques like the tennis ball method, where you wear a shirt with a tennis ball in an inside-out pocket to prevent rolling onto your back. This research is still developing, and a definitive causal link between sleep position and dementia prevention isn't established. However, given our limited options against dementia and other neurodegenerative diseases, trying harmless and cost-free measures like this is worthwhile. Remember, sleep is an investment in brain health. Prioritize it to keep your brain at full capacity. Do you usually sleep on your side? If you enjoyed the video, remember to like and share to spread this knowledge. Subscribe to the channel and see you in the next video. Thank you.